Today we're joined by a couple of experts in the field, and before we get started with them, let me just introduce you a little more to Groundwork Ohio if this is one of the first times you've engaged with us, and then we'll take care of a few housekeeping notes in terms of this webinar. So thanks for joining us. So Groundwork Ohio is the committed statewide nonpartisan public policy research and advocacy organization focused on early childhood education. We advance both early learning and healthy development policies at the statewide level. Here are our leaders. We're led by the Executive Director, Shannon Jones. I'm Lynne Ian Gutierrez. I'm the Policy Director and Legal Counsel here. Julia Honer is our Communications and Development Director. And we have two policy associates, one that just joined us, so you don't see her face here today. One is Vanessa Butler, and our most recent addition to our staff is Julia Jacobs, and we're all here to help you and hope that you view us as a resource. We advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. And we do this because we know that advancing quality early learning and healthy development is the most transformative strategy to increase the lifelong success of Ohio's children and lay a strong foundation for economic prosperity in our state. So thank you again for joining the first of a series of early childhood webinars. We hope to learn with you and share with you what we know and access to experts we have in the field that we look to guide us in our policy development at the state level. We are also cognizant that as we develop policy at the state level, that our local partners and you as folks who touch young children and your local communities continue to need new resources and a refresh on the resources that are available to you and the types of thinking that will all improve how we are serving young children in our state. So without further ado, I'd like to introduce both Teresa and Maggie from the Ohio Center for Autism and Low Incidence. I'll allow them to share a little bit about themselves and their program, but I am going to turn it over to them so we can get started. Okay, thanks for your patience, everyone. Maggie and Teresa, are you able to take over the slideshow? If you guys are talking, Maggie and Teresa, if you could please unmute yourself. I'm unable to hear you right now.
There we go. So sorry about that, everyone. We thought we were unmuted, but we weren't. So going back, this is Maggie Gons, and with me here this afternoon is my colleague,
Teresa Cobelt.
And like Lynne Ian said, we are from OCALI, the Ohio Center for Autism and Low Incidence Disabilities. And so, So we'll just talk a little bit about OCALI and why we do what we do. So OCALI's vision is that people with disabilities have the opportunity to live their best lives. And our mission, or what we do, is that OCALI inspires change and promotes access to opportunities for people with disabilities. And how we do what we do, or our action, is that OCALI is really designed to inform public policy and develop and deploy practices grounded in linking research to real life. So I myself am part of the Center for the Young Child. And the Center for the Young Child is really dedicated to sharing resources, providing training and technical assistance, and consulting and collaborating to impact the development of young children. The Center for the Young Child promotes a strong start for young children and their families, charting a positive course for a lifetime of learning, growth, and opportunities.
And this is Teresa. I'm with the Office of Policy here at OCALI, and it was actually established a couple years ago as we noticed that many policy conversations were happening that had a direct impact on the lives of people with disabilities or their families, but that people with disabilities, families weren't necessarily at the table for those conversations, or disability, people weren't thinking in terms of disability when it came to those policy conversations. So we established the office to make sure that there was really voice at the table, that decision makers knew about critical issues when it came to people with disabilities and their families. And then we work in close partnership with many of our state agencies as well as across the private sector to come up with really practical ways to address some policy issues, as well as to come up with innovation and other approaches that work both at kind of the systemic or state and sometimes even national levels, as well as right down to local or individual agency issues.
So just a little bit more about OCALI for those of you on today's webinar that maybe have not heard of us or are unfamiliar with some of the resources we offer for Ohioans and for people really nationwide. We have several different centers. We mentioned just two of them, the Center for Policy and the Center for the Young Child, but we actually have a wide variety of resources for professionals that touch on a lot of different areas. The Autism Center, the Family Center, Lifespan Transition Center, which is the other end of the spectrum, Teaching Diverse Learners, Universal Design, the Outreach Center for Deafness and Blindness. We do an annual conference every November called OCALICon. We also have Assistive Technology and Accessible Educational Materials Center that is responsible for creating Braille materials and resources for individuals who need that. And then we also have the Autism Strategies in Action Autism Certification Center, which is an online learning platform, and a state lending library where you can actually borrow materials, information, devices for individuals or for your own professional knowledge.
And one of the things that I like to point out, usually if people have heard of OCALI, they often think autism. We have kind of transitioned to just referring to ourselves as OCALI and trying not to spell out the acronym anymore, because while we were originally established around autism and low incidence, I think this slide is one thing that I often point to when I'm having conversations, that we now have 10 centers and one of them is specific to autism. And so lots of other resources here that touch the lives of people certainly with autism, but only one center that's really focused exclusively on autism.
So today's topic was really designed to talk more about early childhood mental health and more specifically about developmental milestones. So in thinking about developmental milestones, one thing we know is that children develop at their own pace. So it's really kind of sometimes impossible to tell exactly when a child will learn a given skill, but we do know that these developmental milestones give us a general idea of when we expect changes to happen as a child gets older. And these milestones are really like these building blocks in the photo. You know, we build on those skills to reach later skills, and when one of those blocks is missing or delayed, it affects development later on as a child grows. And so developmental milestones are really key in early childhood because they have such a strong impact on what happens later. And Teresa is going to talk a little bit more about how that ties into early childhood mental health.
Yes, so There has been a lot of work in Ohio and really across the nation the past several years around trauma-informed care and ACEs, in particular, adverse childhood experiences. And one of the things that we know, Maggie was talking about developmental milestones, we know that there is a connection between the number of ACEs that you have and your development, and we know that there is a connection between the experience of children with disabilities and the number of ACEs that they have. So this slide is really about showing you that this connection is key. We know that for kids who experience ACEs, these adverse childhood experiences, which I'll go in a little more depth about what those are, they're more likely to have an emotional, mental, or behavioral disorder. So the kids that you're working with, the policy discussions that we're having around early childhood, it's really critical to be thinking about those adverse childhood experiences and the connection to emotional, mental, and behavioral health. And similarly, we know that children with disabilities are more likely to experience ACEs than their non-disabled peers. So one, if you have more ACEs, you're more likely to have a mental or emotional behavioral health disorder. Two, if you're a child with a disability, you're more likely to experience those ACEs. And then therefore, we'll see in a couple slides, oops. Just a little more specifically about what those ACEs are for people that may not be as familiar. You could Google this and you would find 8,000 different descriptions of the research behind the ACEs, how they were developed, how they're being used and implemented, thought about. But in essence, they are adverse childhood experiences, specifically things like abuse, neglect, and then what is broadly categorized as household dysfunction. There has been a tremendous amount of research around ACEs and long-term health outcomes, long-term quality of life outcomes, and that basically the more ACEs you have, the more likely you are to engage in what are considered risky health behaviors, the more likely you are to have chronic health conditions. Early death has been attributed to experiencing ACEs. So there is a strong amount of research and evidence behind ACEs and life outcomes. Specifically, I wanted to point out just a couple things that you may see as you work with kids when we think about this connection between early childhood mental health, these developmental milestones, kids that have disabilities. So we know for ADHD, for example, that children who have ACEs are more likely to have ADHD. There has actually been some research that showed if a child had 4 ACEs, they were 4 times more likely to have ADHD. And sorry, we just saw the chat box pop up, and so I was momentarily distracted. We also know that the ACEs increase the severity of the symptoms. So if you already have ADHD and you've experienced ACEs, your ADHD symptoms are going to be more severe, more intense. For children with intellectual or developmental disabilities, we know that 83% of children with intellectual disabilities experience ACEs. We know that they're 3 times more likely to experience neglect, physical abuse, sexual abuse than their non-disabled peers. So again, as you're working with kids and thinking about this connection between developmental milestones, when you have kids that have a delay, they're at much greater risk for exposure to neglect, physical and sexual abuse. And then children with autism, similarly, we see they're twice as likely to have multiple ACEs, much more likely to be bullied than their non-disabled peers. Vanessa had a question about whether or not there are ways to measure resiliency. That's a great question. Sitting here, I don't know that there are ways to measure resiliency. There are certainly resiliency factors, things that can build resiliency. Maggie, a little later in our slides, is going to get into the role of the early childhood professional and what some key things in that relationship are, which I think get at resiliency. But yes, there's an incredible amount of work around and research around resiliency factors, the importance of adult relationships, the value of having meaningful activity, ways to contribute, those kinds of things. So
Yes.
absolutely.
Yeah, that was a great question. So one thing we wanted to build on, so we know that ACEs impact children. We also know that ACEs impact children prenatally. So, sometimes people think that children aren't impacted by these things if they're not yet in the world, but they actually are impacted prenatally by any ACEs that are going on. And so just to kind of highlight, how prevalent is disability in our nation. So some national information that we pulled together from the National Center for Education Statistics is that about 6.7 million students between the ages of 3 to 21 receive special education services. And that really represents about 13% of the population. However, it does not include children in that birth to 3 years range, which is a significant number of children in that early childhood group. And then it also doesn't include any children that are either undiagnosed or what we would consider at risk. And those kids with ACEs would be considered at-risk children. So there's still a big group of children that maybe we're not catching or we're not informed to know how to support. And then it also doesn't include any children that maybe are attending a private school because they have a different system of intervention. And so then taking a look at what Ohio is doing, in 2017, 2018, about 15.2% of all Ohio's preschool and school-aged children, which includes all children ages 3 to 5 and then 6 to 21, was students with a disability, which turned out to be about 270,142 students that were reported to the Ohio Department of Education. And those children were identified and receiving services in school districts in Ohio. And really that meant that about 98.72% of all students identified as eligible were being served in Ohio. So that, oh, sorry, Teresa wanted to.
No, I was just going to say, sometimes I am a very, what might that mean or look like in my setting kind of person. And so I was thinking 15.2% of all Ohio's preschool and school age children. So if you think about, if you run a program or a center and you have 100 kids, 15 of those kids are likely already identified or diagnosed with a disability of some sort, keeping in mind, as Maggie said, that doesn't include, 15.2% doesn't include the kids that are at risk. So if you're thinking across your program, you serve 100 kids, are 15 of them identified? And if not, Maggie does a lot of work around screening and red flags and things like that that are not necessarily for today's presentation, but for sure if you are interested in more about screening and early identification, we can share those resources as well.
Certainly. And so this really highlights for our purposes today that 3 to 5 age group. And really, in early childhood, we maybe look at 0 to age 8, but specifically that maybe 3 to 5 age group. So what about all those kids that are under 3 that are out in the community? So in Ohio Early Intervention, in state fiscal year 2018, there were 32,040 referrals made to Ohio Early Intervention. Of those referrals, approximately 23,438 children were determined eligible for early intervention services, which means that they were found to have some kind of significant developmental delay that maybe through the screening and assessment and evaluation process showed that there was a need to really give that family supports and services to help them help their child in everyday interactions and achieve family outcomes. And this is a trend of continued increases that we've noticed year in, year out. The numbers of referrals go up, the number of children eligible is going up. And as of July 1, with the new budget, there were 2 new areas of eligibility added to early intervention. So that was elevated blood lead levels, which we know can lead to developmental delays, and then also neonatal abstinence syndrome, or NAS, which also can impact development. And both of those things, I think, could probably fall in that ACEs category as well. So, those are things that happen prenatally, again, that impact child development. So when we think about, early childhood, we know the genetic makeup and experiences of children prenatally and early on. That serve and return process that we hear about from the Center for Developing Young Child through Harvard really has a big impact. And those ACEs impact that serve and return process. And developmental milestones impact that serve and return process. And when it's interrupted, the neural connections that develop for different brain functions get skewed or develop that are supposed to develop sequentially, maybe develop in a delayed way or are impacted or interrupted. So, those neurological connections for sensory pathways, then language, and then higher cognition functions. If something happens early on in that serve and return process in development through an ACE or through a disability, we later see challenges with language and reading and academics. So it really, that early years are very critical and important. And it really, that social emotional connection, that serve and return process impacts the emotional well-being and social competence that is necessary for building later skills. If a child with a disability doesn't get the number of serve and returns that a typically developing child does, we're going to see significant challenges in learning and engagement later on. So, children with a disability or an ACE, really, it's no different. The consistent adults in their life, we know, have the greatest influence on their learning and their development. And really, the foundational skills for positive communication outcomes are really this joint attention, that serve and return process, imitation, play, and that these contingent responses we know relate to better language and developmental outcomes for children. And these experiences really need to be embedded throughout their day so that children get lots of opportunities. Because what research tells us is that children with maybe behavioral concerns, that have had an ACE or a developmental delay actually get much fewer chances at these interactions. A typically developing child maybe gets 5 chances within an interaction, and that child with a disability maybe gets 1. There's a lot less interaction, so they actually get fewer chances to practice that serve and return process in development, which only further delays their learning. So as early childhood and early care and educators, what we know is that gaps in development tend to appear before children actually turn age 2. And this graphic is from 0 to 3. And what we know is that, especially children in the lowest socioeconomic group are behind their peers in measure of cognition, language, and social emotional development. And that again goes to those ACEs, that there can be fewer words that children are exposed to, which then, helps widen the gap, really. So really, as our job as early care and educators is that we really make a difference in helping shape brain development, developing school readiness, and closing that opportunity gap that happens so early on. Because this happens a lot of times when children are very early on, and then as children develop, the gap only widens. So just wanted to highlight this really cool resource from the 0 to 3. They did a survey called Millennial Connections in 2018, and they polled over 1,000 parents and caregivers. And I thought it was really interesting to find that they're seeking input. Where do they trust information? And they are seeking input from healthcare professionals, immediate family members, friends, and then as teachers and childcare providers or early childhood professionals, they trust you. 59% of the time they are coming to you as early care and educators for reliable, solid information on child development. So really, our job is to provide them with current, up-to-date, evidence-based information that helps families make good choices for their child and influence development for positive outcomes.
We also wanted to share with you some key findings from family surveys. So Maggie has been talking about, these gaps and identifying some of these gaps. One of the things that we know from both national research as well as surveys done here in Ohio is that families are almost always the first ones to notice these gaps or delays. And they are also almost always told to wait and see. Both a national survey that surveyed over 4,000 parents, as well as a survey we did recently here, OCALI did on behalf of the Ohio Interagency Work Group on Autism. Both of those surveys demonstrated that families, in the national survey, it was 1 out of 2 families, or 50% of the families were told to wait and see, or that the child would grow out of it. The behavior was normal. In the survey that we did for the Interagency Work Group on Autism, over 90% of the families were told wait and see. Now, neither of these groups knew at the time that their child had autism. What they knew was that they were noticing something, and what they were largely noticing before the age of 3, the number one concern was behavior. And so families were going to a healthcare professional expressing concerns about behavior. The second highest concern, like Maggie was talking about, was sensory, and the third highest concern was eye contact. So families are noticing these concerns, and again, 9 times out of 10 in Ohio, for the families that responded, they were told to wait and see. So I think we've talked here about the incredible opportunity that early care and educators have as families express those concerns, knowing, even being able to coach families through this idea of, you may bring this up with a healthcare professional, you may be told, wait and see. There are other resources in Ohio that can help kind of ferret out some of those, the concerns that families might have, and whether or not it is a delay, whether or not it is normal. But Maggie will share a little more even about those conversations with families.
Yeah, and so building on that, as early childhood professionals, sometimes our role is to be able to talk to families. Hopefully we have good engagement with our families. We're communicating regularly, so we're not only communicating about our concerns. We definitely want to have a relationship with the families that we work with. But we do need, as early child care professionals, to be able to act early. You be able to talk regularly about child development with families, share reliable evidence-based resources, so you're connecting families with the best information that is out there, because we all know Google brings back a lot of crazy things, and there's a lot of cool technology app type things that are out there that maybe, as we're finding out now, doing more harm than good. So it's important we direct families to the places of reliable information. And then also just to listen closely. A lot of times when we bring up our concerns, it's maybe something the family's been concerned about, but you're the first one to acknowledge that you also have a concern and share that with them. So a great place to go for resources about developmental milestones and how to talk to families, resources for families to know how to talk to their physician or their medical partner, can be found through the Center for Disease Control. There's a site called Act Early, and they have some online webinars, modules, lots of handouts, but there's some really great resources out there for this specific thing, and connecting families and yourselves to equip you with the tools you need to have those conversations, because they're hard.
Mm-hmm. I think the other issue that we wanted to share with you all, again, as you're thinking about these conversations with families and where do we point families, one of the things that we found from some national research as well out of the Children's Hospital Associations is, when you look at some access to care issues that families have, whether they're trying to address delays in disabilities, whether it's ACEs, mental health, whatever it is, some of the biggest shortages that we have are in the very areas needed to help with some of these developmental concerns. So developmental pediatrics, child and adolescent psychiatry, and pediatric neurology were the top ranked workforce shortages from children's hospitals, with an average wait time to see a developmental pediatrician being almost 5 months. And then I think one of the things that's really concerning to us, and I know to you all on the phone, and it's been something that Groundworks has really elevated in conversation, is the disparities that we see, not only just among kids who have disabilities, but then and they're typically developing peers, but then within the kids that have developmental disabilities, that kids from racial or ethnic minority groups are much less likely to receive timely care. They're much less likely to receive the amount of care or service delivery that's needed, and that's obviously concerning to everybody, and we need to be thinking about and looking at that.
Yeah, and I'll just add on to that, having been a direct service provider previously in rural areas of the state, definitely, geographic location can be a big factor. If a family, there aren't as many local physicians that families have access to, and so they may be driving 2+ hours to their local children's hospital, or they may not be able to access the resources to help their child with a disability. So, it may be recommended that they get a certain type of intervention or service, and families may not be able to access those services because they're not available locally. And so families are using significant amounts of time with their young children to travel back and forth to get those services if it's something that they have the ability to do. So there's definitely, access issues when it comes to geography in the state as well. So one resource that, if you're not familiar with, we really wanted to highlight that's free to all Ohioans is Help Me Grow. And that is the central intake for a variety of early childhood home visiting programs in Ohio. So you can kind of see Help Me Grow is this big, huge umbrella for a lot of different things. So a family can make a referral. They can refer themselves. A physician can make a referral. You can go online, you can call, but this is the central intake that runs a connection to find out more. So when a family has concerns about development, they call this number, and based on the conversation or the intake information that they provide, they are referred to Ohio Early Intervention or Early Childhood Home Visiting, or sometimes families connect with both programs. And Early Childhood Home Visiting through the Ohio Department of Health has a wide variety of home visiting programs available for a variety of different purposes and vary throughout the state, but there's a lot of different programs. And then Ohio Early Intervention is actually Ohio's statewide system that provides coordinated services to parents of children birth to 3 years with disabilities or developmental delays in Ohio. And so this is really that network of children that have been identified with a disability. So you may have a child that's participating in home visiting programs, and that child, you have concerns about their development. It's totally okay. We highly recommend, if you have concerns about development, also refer them to early intervention, because there are professionals out there that are trained and skilled at assessing young children to really capture whether or not development is maybe going as anticipated, or if it's maybe got some delays. And what we find is that regardless of disability, the earlier we intervene, the more positive life outcomes we see for young children. And so intervening early really has a huge impact in changing a young child's trajectory for development.
And while anybody can make a referral, I will say that the research definitely tells us that when the professional makes the referral, and then when the professional follows up with the family on the referral, the family is much more likely to engage, follow through. And I don't think I shared this in my introduction, but I am the parent of 2 children who have been involved in a variety of systems. And I can tell you, I have a coworker, we joke like, oh my gosh, I can't even return a phone call, let alone if somebody says, here's another thing to put on your plate to, make this referral, take the time to answer these questions, do those things. So I think that a role that early care and educators can really have that can be helpful, incredibly helpful to families, is just to help facilitate that referral.
Yeah. And so then I wanted to take a second to so pause with me while I wait for the screen to advance. There we go. Okay, so another resource that I really wanted to highlight, since we're talking about developmental milestones, early childhood mental health, is through the Ohio Department of Mental Health. There is actually a really wonderful consultation program in place. It's designed specifically to reduce preschool expulsion and prevention. And so they have a wealth of resources. They have a whole toolkit. It's really designed for children both through age 6, resources, supports, and consultation in your early childhood setting, specifically around the topic of, behaviors. Because one of the things we know about early childhood is, all young kids have behaviors, and sometimes those behaviors get challenging. And so they really are on this mission to prevent preschool expulsion and to empower you as the early childhood professional to have the tools and the skills you need to help that child be successful in your program. And so that's, again, a free resource. The number is there. They have a lot of great resources online, but it's a really wonderful program, and they've divided up regionally too, so that they can meet all the parts of the state. So just real quick, we've covered a lot of information, but one of the things I wanted to highlight, I skipped a slide, there we go, is that the Ohio Department of Developmental Disabilities is a great place to get information. We have the Ohio Department of Education that has information specifically about special education for those children that are preschool aged. And then also in the state, we have this great website called Bold Beginning. And there is a lot of information on that site that is a cross-agency tool. So it has access to information from Ohio Department of Health, early intervention through the Department of Developmental Disabilities, Ohio Department of Jobs and Family Services, mental health, and I'm sure I've forgotten another agency, ODE, Ohio Department of Education. So it's this crosswalk of cross-agency resources and materials where you can find information, and it's a great place to send families as well. So I just wanted to highlight, if you haven't been to that site, to check it out. And again, so some family resources, that Bold Beginning that I mentioned, that Learn the Signs Act Early for the CDC has great resources for families and professionals. The CDC actually has a milestone milestone app tracker, so they can download an app and track a child's developmental milestones themselves, to stay on top of it, especially, if you've been in a physician's appointment and they ask the family about a child's development and they weren't prepared for that question to know the answer to it, or it wasn't something they knew to pay attention to. So it prepares families to know, or maybe what to expect the doctor to ask about. There's the Ohio Coalition for the Education of Children with Disabilities for families. And then I wanted to highlight the First Words Project. So like Teresa mentioned, a lot of times we see children with social communication challenges as a kind of a first sign to a delay. And they have some really great online resources for families and professionals, specifically around social communication. And they have a tool called Baby Navigator that families can self-screen their child much earlier than some of our other screening tools. So one of the things I think Teresa brought up earlier is that, if in schools we have 15 children out of 100 that have a disability in your program, and then we know there's a lot more children at risk, really those children are in your care, you are educating them, you are providing care for them each and every day. And so what we know is that including children and with disabilities and early childhood mental health issues is really, we need to include children with disabilities in early childhood programs together with their peers without disabilities. And there's a wealth of research on the benefits for these children that are at risk, the benefits of children with disabilities, benefits for children with mental health concerns. And there's also a wealth of research that supports the benefits it has for those children that maybe don't have those challenges in their lives. And this is really comes out of a policy statement on inclusion that was put out by the U.S. Department of Health and Human Services and U.S. Department of Education back in 2015. And it's really been a concept at play for a very long time. And so we continue to work towards that because there definitely are challenges, but it really takes this lens of designing universally for all children so that all children can succeed.
And when we were talking earlier about ACEs and resiliency, I think inclusion is one of those resilience factors as well. So some of the things that we look at when we look at building resiliency, we look at positive relationships, we look at self-image, and what we know about kids who are separated from their peers, who are thought of as different, who are not included. It does not build those resiliency factors in the same way that being a part of the regular, quote unquote, regular classroom does.
Yeah. So we just wanted to kind of give some time for questions, but before we go on to some questions or anything you guys wanted to know about, we wanted to highlight some of the resources we have if you're not familiar with OCALI. So the Autism Certification Center is a wonderful resource. It has online learning modules, and they are all OCRA approved. And I think you can get up to, I want to say a lot. I don't know the specific number. So it's free to all Ohioans. And there's a first course called The Many Faces of Autism that's great for anyone that wants to know more about people with autism. And then there's actually specific modules for toddler and preschoolers that have videos, interaction, online learning courses, and it's approved for educators, it's approved for Step Up to Quality. You know, I took it as an SLP and got credit. If you're an occupational therapist, a social worker, there's a wide variety of ways you can get access, and you can even use it as a group learning tool as well. There's a way to set it up, and you know, if your whole system or group wants to do it together, you can utilize that option to get credit.
And one of the things about those modules, I will say, even though it's called the Autism Certification Center, and that has to do largely with who paid for it, but the content itself is very, I mean, it would be like, how would you provide visual supports to anybody in your classroom or your center, or what are just good behavioral principles, joint attention. Any kid benefits from you being better at helping to develop joint attention. So I just want to offer that disclaimer that I know there's some people that are thinking, well, you know, we might not be working with anybody that has autism, but they are just good strategies across the board that anybody could use.
Yeah. You know, I think one that comes to mind in the toddler preschool module is there's a whole, you know, unit on tantrums, or, you know, and talking about meltdowns and how kids maybe are in the rumble stage, and then they're in the stage where they've stopped rumbling and they've exploded. And so intervening before you get to that rumble stage, and that's a strategy you can use for any toddler, because, you know, or adult maybe. So those are really helpful tools. And I apply those to all the children I work with, not just children that maybe have a diagnosis. And then again, our lending library that has a wealth of resources. You can look online and see and borrow things. We have our Outreach Center for Deafness and Blindness, which just launched a new module called Promoting Access, about getting access for people who maybe have a visual impairment or a hearing impairment, and some ways that and strategies we can utilize to help them have access. And they will be pursuing OCRA credits for it, so look for that, definitely. And then also we have our Family and Community Outreach Center, and the link there would take you to a great little basic introduction to autism spectrum disorder for families that was created. It's really family friendly. It's a short introduction book, and it's really designed to be for parents or anyone that just wants to know more but doesn't want to read a novel. So it's a great highlight of what it is. And then our Center for the Young Child, we have something called Tidbits for Toddlers, which are really designed to be little videos. So they're less than 10 minutes long, and they kind of give a brief overview. So, you know, one is about what is autism. There's another one about accommodations and modifications and what those are. And then we also have one on what are evidence-based, or what is evidence-based practice. And so we'll be continuing to update those, but those are really designed to be short on-the-go videos for professionals or families. And then we have our Autism Center as well that has a wealth of resources, and they do a preschool autism training for people that work with children. So thank you. And it looks like we have time for some questions. So if we sparked something or you want to know more, feel free to ask away. And so
And hi, this is Lynne Ian from Groundwork Ohio again. You can answer a question. There's a Q&A chat box, so you can ask it that way. We have so many folks online, it'll be more helpful to do it this way versus unmuting you on the line, okay?
all right.
I see one question here.
Yeah, I was just going to say, so I think we maybe answered Vanessa's question earlier about measuring resiliency for children who have higher ACEs scores. And then it looks like we have another question about the data on children who experience or witness domestic violence or sexual assault and developmental or intellectual disabilities.
You know, it's interesting. There's actually been a move to try several proposals to try and change or get something added to the Diagnostic and Statistical Manual, the DSM, to include trauma developmental disorder, because there are people who firmly believe that witnessing domestic violence, sexual assault, absolutely, like we said, I mean, ACEs impact your development, they just do. And so there is a large body of research and kind of this groundswell of advocacy to get something added to the DSM called, it's controversial, not everybody supports it or thinks it's a thing, which is why it's not in the DSM yet, but there's a white paper out about it on trauma developmental disorder. If you were to Google it, you could probably find it. We're happy to share it too with Lynne Ian to share with others if that's of interest.
All right. And so then we also have another question from Vanessa about whether there has been outreach or communication efforts with medical students to encourage them to pursue fields of developmental pediatrics and those shortage areas. And I think there continues to be outreach on those efforts in various capacities. Unfortunately, the specialties that there is such a need for require extensive training and schooling. And in general, there is a shortage of just general physicians nationally. So not only is there a shortage in these specialty critical areas, there's also just a shortage of physicians in general, which is why we're seeing an increase in nurse practitioners and physicians assistants, and also the expansion of telepractices, because there are certainly areas where it's not sustainable to be a physician in parts of our country.
And the Department of Developmental Disabilities does have one partnership that's specifically with Wright State, and I'm blanking on the name of the medical college at Wright's, Boonshoft, through Dr. Julie Gentili, who is in the psychiatry department there, that they are actually trying to build and have been for some time the capacity of psychiatry in Ohio.
Great questions. Oh, all right. So we're realizing we have different question locations. So, wow, it just popped up a bunch. So Kathy had a question. She said, are there any telehealth options for services in the rural areas, and what services are available for childcare providers if they feel like they'd like training on handling behaviors? So I can answer that, Kathy. I actually used to previously work in doing some telehealth in early intervention through a pilot. So I think Department of Developmental Disabilities is exploring that. And certainly a lot of school districts in rural areas are utilizing telehealth to get some maybe professional expertise to support children in schools. So it's definitely coming. I think there definitely are some hiccups in regards to some billing and how do you utilize insurance. So sometimes our policy doesn't keep up with the needs for children. So sometimes there's a lag there. And then also, as far as childcare providers that want training on handling behaviors, I would reach out to the early childhood mental health consultants. They have some really nice trainings that they do, and they have some really great materials that you can access. And then Megan had a question about the number of families that are told to wait and see when autism is large and what's being done to address that. And I know through our agency and through multiple others, we continue to reach out specifically to physicians and develop materials and resources about dispelling that policy or that practice. And we also continue to work with early childhood professionals as well, because sometimes we just don't want to say something. It feels weird or awkward. And really what we tell people is it's better to say something and have tools and strategies in place versus waiting and wishing you could have done something.
And that's another, so that survey result that has been shared with the interagency work group on autism, and it is absolutely something that we've prioritized. And as Maggie said, whether it's through existing partnerships with children's hospitals and the Ohio Association of Pediatricians, and we feel like the other really important component to that is families. How do we let families know that if you have a concern, you are likely to be told, wait and see, and that you do not have to wait and see. Anybody can make a referral to early intervention and participate in a developmental screening. And so there's no reason to wait and see.
And then Julia had a question about how can we improve early intervention outreach to identify more children who need supports earlier. And so I would encourage you to check out, there's a specific module on the Learn the Signs Act Early. They have a great online resource about developmental monitoring and developmental screening. And so there are, if you are in a program that is Step Up to Quality rated, there are tools available depending on where you're at. Available for screening free through the Department of Jobs and Family Services that you can access. There are specifically some screening tools that you can utilize through the CDC. There are, a survey that physicians use a lot of times is the Ages and Stages questionnaire, that requires some training. But there are some different tools that you can utilize and get some support on to feel more comfortable with that. Because we certainly don't want to arbitrarily refer people, but we do want to be informed about what to expect and when. And if you're not sure, just having the family or, connecting the family with those professionals that can do that. I think it's always better to do something earlier versus later. And then Katie had a question specifically on the mental health red flags for young children. And when you would refer them to a mental health intervention. And I would say that those red flags for a young child with mental health concerns are probably very similar to child with developmental delays. We also know that if maybe there are some ACEs at play or there's some risk factors already inherently with that family, to go ahead and make that referral. Ohio's early intervention system is working on adding early childhood mental health consultation to every team of specialists in every county, so that counties have access to an early childhood mental health professional. So if you have concerns, I would go ahead and make that referral. And there's, part of a developmental specialist's job is to really know about social skills and social communication and social emotional development. And so there are people equipped on that early intervention team to know how to intervene and spot those things.
I think the other thing that's really important, Katie, as I read your questions, is one of the things that's interesting in the childhood realm, we have behavioral health that kind of goes away once you become an adult. There's a much, it's kind of mental health and medical, and behavioral health sort of disappears, which is a challenge for a lot of people. But so I'm saying all this because in the early childhood realm, I think one of the broadest, I guess, conversation that you can have with families that's maybe a little more, less stigmatized is this idea of behavioral health as opposed to mental health. And so the thing about behavioral health is you don't know at that point, is a tantrum about the fact that the child can't communicate. And so they're having a tantrum because they don't have words, or they don't know how to use those words, or there is literally physically something going on that prevents them from communicating. You don't know if it's because they are in pain and they can't communicate that pain. You don't know if it's because they do have autism, or even just a sensory issue, that there's some dysregulation that's happening. So I think one of the things that we have found kind of to be the most effective is to talk just broadly about behavioral health. And then because you really don't know if it's about a developmental delay, you don't know if it's something related to mental health or ACEs or whatever it might be, but just sort of this general realm, if that's helpful at all, to think of as just behavioral health and trying to figure out what is going on, what's causing some of the, or leading to some of the behavioral challenges. Or we have a colleague that refers to it as, behaviors that are interfering or interrupting things that are going on, and why is that?
Okay, this is Lynne Ian from Groundwork Ohio. Again, it looks like we don't have any more questions and we're right at 2 o'clock. I just want to thank Maggie and Teresa for joining us today and providing, I think, a really just a wealth of information and resources to those of you who are directly working with young children, and also gave us a lot to think about as we inform and influence statewide system policy for early childhood and the new investments that have been made in the early childhood system even within this year. So thank you so much. We're grateful to have OCALI as a partner in this work at the state level. And I do want to remind those of you who are participating, think about who you'd like to share this information with. It will be available on our website here within the next week or two, both a recording and the slide deck. We have 2 more webinars scheduled at this time. The first is September 26th at 1 o'clock. We will be hearing from Cindy Oser, who's a nationally recognized expert in infant and early childhood mental health, who most recently led this body of work at 0 to 3, a national organization, again, an expert in the field of early childhood mental health. And then on October 9th at 1 o'clock, we will be hearing from the Ohio Association of Infant Mental Health and getting a number of different provider and perspectives from the field on this work. Please engage and register with us through the Groundwork Ohio newsletter that goes out every Friday morning. If you registered for this webinar by a different means and you didn't get it through our newsletter, please go to groundworkohio.org and register to receive our newsletter. We promise to continue to provide you with really valuable snapshots of information, how you can get more resources, and certainly continue to participate in this webinar series. Thank you very much. And here is Groundwork Ohio's contact information. You can reach any of our staff at groundworkohio.org. I hope you have a fantastic rest of your afternoon, and we look forward to working with you in the future. Bye-bye.